during pregnancy, you're almost taught to avoid core strengthening, support. But what your pregnancy and your pelvic floor need most right now is core support. If you are struggling with pain, leaking, or you just want to feel good and strong during your pregnancy, this is a way to support your core that is different than just a core workout. We're incorporating core support with your pelvic floor. This is going to help not only with your pregnancy, but with your recovery as well. We're gonna go ahead and get started. If you have a ball, get yours out. If you don't have a ball, that's okay. You can do this standing up instead of seated on the ball, or if you're comfortable doing it laying down, you can do it laying down as well. We're just gonna start with some marching. I'm gonna get my timer started here. We're gonna do each movement for about 1 minute, but I want you to focus on your breathing. No holding your breath, none of that, okay? So we're gonna do some marching. So as you do it, you're gonna breathe out and feel your core supported. So you're hugging your baby. Breathe out, hug your baby as you lift and march. If you need to hold on to something because you don't feel secure, hold on to this furniture or a wall, but you're just gently lifting your legs and you should feel your core supporting this. Don't hold your breath. Try not to clench anything. Just a nice, gentle hug the baby. I'm holding my core as I'm breathing, so I'm still able to talk. So we don't want you to hold your breath during this, okay? So as you breathe out, you're hugging your baby, you're tightening that core if you can. You're providing your pelvis with that support. This is going to be really important, especially as you enter third trimester. Okay, so just nice and easy. If this is real easy, you can do opposite arm and opposite leg. Beautiful. Okay. Now we're gonna come on down to the ground. We're gonna do a bear lift. So what this looks like is on your hands and knees. As you breathe out, you bring your baby up towards you and you lift off your knees, okay? If you can't lift off your knees and all you're doing is bringing that baby up towards you, hold, and then relax. So here we go. Inhale, your belly drops. Exhale, belly comes up, you tighten. If you can, lift the knees off the ground. Make sure I'm still holding that contraction. I'm not holding my breath here. So don't hold your breath. And then inhale as you come down, belly comes down. Exhale, lift up. If you can't lift up to off your knees, that's okay. Just do what you can, okay? So you can just stay in this position and tighten the core. This is what your belly should look like while you're doing it. Inhale, belly drops. Exhale, pulling up and in and tightening. So it's like you're giving your baby like a hug. Exhale, or inhale, exhale is here. Okay, just like that. Just nice and gentle. If you can hold the lift, that's a way to make it harder. Okay. Okay, this next one is incline mountain climber. So you can use the edge of a couch, a bench press, or a bench, something like that. A chair. All you're doing is you breathe out and you pull the leg in, okay? If this is too easy, you can do it on the ground. If this is too hard, you can do it against a wall and bring those legs up. Trying to breathe out and hold that hug. Hug your baby. So breathe out, hug your baby. Nice and easy. Make sure you're not holding your breath. Make sure you're not feeling like pressure or heaviness. We want your core to feel supported. We want your pelvis to feel supported. Nice and easy. Breathing out as you hold that. So no holding your breath. Take a break if you need to. Inhale. Exhale, hug your baby. Good, take a break. Okay. We're gonna do standing march. You can do this with a weight at your side to make it a little harder, or you can just do it standing. You could do the weight at your side down below or up above. So there's variations that you can do with this. Hug baby as you lift up. You want to hold that contraction if you can, or like hold that hug. If you feel like you can't hold it, take a break. Inhale, exhale, hold that like hug, tighten that up. If you're not sure if you're doing it right, put your hands on your hip bones, okay? Hands are on your hip bones right here. Just come off to it's a little squishy. You should still be able to feel this even pregnant. As you exhale and you tighten, you should feel the smallest flicker underneath your fingers. That's your core. That's to know if you're doing it correctly, okay? So if you're not sure if you're doing it right, make sure you put your hands on your hip bones. Just come off to that squishy part. You should feel the lightest flicker of your fingers, and it should stay there as you do the marching, and then you can take a break. It relaxes, you don't feel it. You exhale and you hug the baby again and you feel it, okay? That's it for that one. We're gonna end with a gradual cat-cow, which a lot of people are familiar with. So this is just gently arching that back and then rounding. We really wanna focus on your breathing and having that support with just some simple breathing, okay? So you're going to inhale on your way down. So when you arch, your head comes up, and then you exhale as you round. Really push through those shoulders up in here, and then inhale as you arch down. Exhale as you come up and pull up, okay? Inhale as you come down. Exhale as you round. So whenever you do something that's working those muscles, we want to make sure we give those muscles a chance to relax after. A lot of pain, leaking, pressure, heaviness can come from tension and tightness in your body. We want to limit that. We want you to have pregnancy without pain or with significantly less pain. Last one. We want you to feel comfortable and supported. This is my goal throughout Pelvic Floor Mama. It's why I created the B.S.R method. It's teaching you how to support your core and your pelvis and your pelvic floor so you can have less pain, less leaking. If you want to go through, if you want more help, more support, if this feels good, there's two options. The pain-free pregnancy and postpartum package is your complete pelvic floor roadmap through pregnancy, birth, and postpartum. So you can move with less pain within 2 weeks. You can feel strong, comfortable, and confident in your body while you prepare for a birth with less tearing and easier recovery. And always support. You have me in your back pocket, so you can ask questions. You have unlimited access to me throughout that option. That's linked below or on my page. Or you can do the 5-minute Mama Relief Reset. This is where I teach you the basics of the B.S.R method that I've created that go beyond just Kegels and just exercises. It's how you be able to feel true strength and relief in your body with implementing 5 minutes a day for 5 days with this 5-minute Mama Relief Reset. The options are linked below. Make sure you check them out and join. Pregnancy pain is common. It doesn't have to be normal. Your pelvic floor needs you to learn how to support it so you can be able to roll over and walk and get dressed and just live your life with less pain and discomfort. Pregnancy pain is common. It's not normal. It doesn't have to feel like this. So if you want to feel strong and comfortable in your body, whether you're pregnant, preparing for birth, or postpartum, make sure you check out